Hello, everyone.
Hello.
Hello.
Hello, good evening, everyone.
Okay, let's start. Thank you all for joining us today. Welcome. My name is Dilara and work as the marketing team lead at OneWell Health Care. Katie is with us from our marketing department as our marketing specialist. We organize webinars on a regular basis to introduce OneWell's opportunities and also services and lots of information. And today we will be talking about our transportation services, an important resource for families and for our organization. And today our webinar topic is Smooth Rides, Big Dreams, Real Independence. Discover how OneWell Healthcare and Uber Health support your loved ones and on their journey. And our transportation manager, Charles, will share all the details with you. And at the end of the webinar, we will be happy to answer your questions. Please feel free to write any questions in the chat section. You can also follow our social media by searching for OneWell Healthcare, where we announce and broadcast many of our events and webinars and some kind of activities. I will leave the link here shortly, and now I would like to hand things over to Charles. Thank you.
Thank you, Dilara. Hello, everyone. Thank you for joining us tonight. As Dilara mentioned, we're here to discuss our Uber transportation services, as this is one of our really popular services for individuals. It can open up a lot of doors to employment, to that community access, to social opportunities for our individuals. As most of us know, being in the IDD healthcare field, transportation can be a huge barrier for a lot of individuals. So I'm going to go ahead and share my screen with everyone, and we'll go through the presentation. As Delara mentioned, we will have a Q&A section at the end where everyone can feel free to answer or ask any questions that you have, and we'll provide any answers we can. All right, so let's get this moving. So again, in today's agenda, we'll be discussing OneWell Health Care, our clients using the service, why Uber Healthcare, collaborative innovations with healthcare between Uber Health and OneWell, the benefits to having Uber transportation services, how it looks to activate services from start to finish, what our app looks like, and some of our other healthcare services. Before closing, we do have a couple of quotes from some of our individuals that we'd like to share, and then at the end, we'll have our Q&A. So, as I mentioned, my name is Charles Nightlinger. I am the Transportation Service Manager with OneWell. I've been with OneWell just shy of 5 years now. It's been quite a journey. I started all the way from direct care and moved my way up to program specialist, team lead, all the way to manager of the transportation department. So I've been in a lot of different roles with the organization. I've worked on many different fronts. Again, from that DSP to that program specialist care. So I really understand some of the struggles and barriers some of our individuals have. If you'd like to contact me, my email is listed on the slide and will be available at the end of the slide as well. I'm getting some notes that people are having a hard time hearing me. Is that true for everyone? Okay. I'll try and adjust the settings just to help those individuals maybe move a little closer. So a little about OneWell and our mission. Our mission here at OneWell is to deliver better healthcare and wellness outcomes for individuals, families, and communities through innovation and quality care, with our vision of being transforming healthcare through quality, person-centered care and innovation. Our core values encompass respect and trust, the commitment to our individuals and their families, assessing all situations with compassion, dignity, and courtesy, and working on new innovations to improve the healthcare field for our individuals. OneWell has come a long way. We started uh, in our PAHM division back in December 2021, where we moved to our first expansion in New Jersey, to California, to Connecticut in 2023, along with South Carolina, with our Georgia, Ohio expansions, Georgia, Ohio, and Colorado expansions coming as well. We've just recently expanded into the Ohio territory, so we're very excited to start bringing services to those states as well. And then IDD across the state of Pennsylvania. Our services are proud to offer not only Uber transportation, but our in-home and companion services, nursing, CPS, behavioral support, supported employment, home modifications, occupational therapies, speech therapies, and assistive technologies across all of Pennsylvania. We do work with the primary 3 ODP-funded waivers, being the Person Family Directed Supports waiver, the Community Living waiver, and the Consolidated waiver. And we do operate in all 67 counties across Pennsylvania, with different regional offices located in those counties. Since starting our Uber Health program, we've only seen our clientele grow. So just this past year, we have broken our milestone of over 1,000 individuals utilizing Uber transportation services since the start of 2021. Roughly, that makes about 10% of our overall individuals that we service across our different states. So it's truly amazing to see how much this service has grown, how much of a need that we're meeting for these individuals. A lot of questions come up when people learn about Uber transportation services. Why would they go with Uber versus other established transportation options like public transport? The benefits of waiver-funded transportation services through OneWell include safety, reliability, independence and freedom for the individual, cost-effectiveness for their waivers, and a dedicated supports team that are there to help individuals of all skill set. We're proud to service individuals of both high and low skill sets to help them increase their independence, give them that freedom and flexibility back into their lives. We see the common uses for transportation services being things as employment, volunteering, social opportunity, and one of the biggest ones is being integrated into their community. It's easy for a lot of individuals in the IDD field to become isolated and separated from their peers, their families, because they don't have access to reliable or consistent transportation. If you're an individual in the IDD community, navigating public transport, such as bus routes, can be a challenge, and there's no one there to help support you in those day-to-day tasks of navigating your bus routes. Buses don't provide reliable transportation to employment. One of the biggest leads for individuals not finding employment is that transportation, whether it's consistent or reliable transportation. Waiting for a bus can cause individuals to be late for work, missing their scheduled start times, them getting disciplinary actions at their place of employment, and then ultimately losing that employment that they've worked so hard to obtain. And that's one of the key factors to feeling fulfilled in your day-to-day life. Everybody wants to have a goal and have a purpose and have something to work towards, and not being able to do something such as simple as finding employment can really put somebody back. It can put them in a bad mindset that they want to be active and involved, but they don't have the means to do so. So there are a lot of uses for the Uber transportation services. Now, a lot of questions do come up about the transportation service. Can it be used for medical appointments? And it's kind of a loaded question. So yes, it can be used for medical transports, but when it comes to waiver funding, most counties and AEs like to see that there are other options being utilized first, such as natural supports, or there are service providers that go through MATP, which is medical assisted transportation providers. These providers tend to offer very discounted or prorated service costs for individuals that just need medical transport. So most AEs will try to utilize these services first. But again, there are some limitations to those services. They are stuck within their county lines. Um, they have their own operation hours, which may not be conducive to individuals that need to go to medical appointments because they have to visit a specialist that's outside of their area, or their doctor only has certain time frames available and those providers cannot meet the need for the individual. In those cases, Uber transportation services through their waiver could be requested as the next most cost-effective option for them. It's just we have to pursue those other options first. So even though it's not listed, medical transportation is a possibility with the service. Our collaborative and innovation healthcare with Uber Health and OneWell. OneWell's innovative approach to rational healthcare solutions advanced collaboration within state and participant levels, development of automation systems for accurate state reporting. We simplified the complexities of the paperwork for the participants and families, so our intake process is very simple to get somebody started. Through their waiver, we're able to set and maintain budgets for those individuals, where it automatically calculates how much is remaining in their budget after each trip is successfully completed. So we're able to pull that information upon request for service coordinators and participants if they'd like to know how much is remaining in their budget for their fiscal year, and ensuring financial transparency and efficiency for our individuals. As part of our service process, we always assess on a person level basis what that individual needs for their transportation. If they just need it for employment, if they're looking for social and leisure opportunities, whatever their transportation needs are, we assess that for each individual. OneWell Uber team. So we do provide a dedicated supports team to assist all of our individuals. Again, we're very proud to say that we support individuals of both high and lower skill sets to ensure that they have smooth rides. This can extend from anything to booking rides, checking who their drivers are, ensuring that they're getting picked up in the right location, and tracking those rides for them if they are concerned or they don't know how to see where their drivers are located. And then with our professional team, we oversee that participant safe journey, continuous monitoring to make sure that their services are successful for them. And we provide notifications for them when their trips are beginning and completed for the families and the individuals that would like to watch. And again, those benefits for having Uber Health, enhancing the healthcare mobility, that dedicated supports team. We have our own team of Uber transportation specialists that assists all of our individuals from the start of service all the way through their journey with getting rides till they no longer need the services. The annual report authorizations, again, we are able to pull reports at any time to see how individuals are utilizing their services to make sure everything moves in a streamlined fashion and there's no headaches for their SCs or families involved. And then the person-centered care, as I mentioned, for every one of our individuals, their budgets are customized uniquely to them, whatever their transportation service needs are. If they just need employment transportation, they have volunteering opportunities, they want to be social and go to places, meet people, we can work with them to put a plan in place and an appropriate budget that allows them to achieve their goals. We want all of our individuals to be successful. Some of the benefits for Uber Health, you're able to track your drivers from the moment a driver picks up a ride to the moment that ride is completed. It is you are able to track that driver, and that goes for anybody that has access for that individual's account. So family members, support staff, somebody that individual designates as a needed person in their life to assist them can have access to track their drivers, see who they're getting picked up by, schedule rides for them or cancel them as needed. We offer a very user-friendly experience. My ongoing joke with our service department is that we like to call ourselves Uber Light because through our OneWell app, we kind of taken how Uber sets up their traditional rides and made it simpler for individuals in the IDD community where we can preset destinations for them so they don't have to type in addresses, add payment methods. Everything is easily accessed by just clicking on a trip, automatically entering the addresses for them. They just have to choose a date and time that they'd like to have their ride. That budget tracking and calculating through our team, we find that budget for them, what's appropriate, what that works within their waiver in order for them to be successful, and we're able to track and maintain their utilization. That way they're accessing their services while staying within their authorization budget. Those social opportunities are very big for most of our individuals. Uh, Public transport, they're not going to take you to your best friend's house. They're not going to drop you off at a family member's home. They may not run close enough to your destination and you have to take multiple buses. With Uber's transportation, it's a pickup from your destination and a drop off at your destination. No stops in between. You're going from to and from. You don't have to worry about any kind of transitioning. Increased employment opportunities. Some individuals are limited to what opportunities they have for employment based on what's available with that public transport. With Uber's help, they now have wider range of access for employment. They can find new opportunities, maybe a job that fits them better, that pursues their interests more, that opens up a lot of possibilities and opportunities for those individuals and being part of that community. One of the biggest risks for an individual is not being part of their own community, having their face known, having their presence made known in their own community. Um, it's easy for an individual to become secluded, not be part of their community, and then they have no natural safety network in that community. By having access to transportation, they can build those social bonds. Their faces become known. So, part of their community is looking out for them. They know that if John Doe doesn't show up for his weekly latte at the Starbucks, um, those people are recognizing that he's not there and they want to make sure that he's okay. So having those social bonds not only, supports that individual, but goes to supporting their health and safety as well. Now, when it comes to obtaining Uber transportation services, there is a typical activation flow for individuals, and it starts with a client referral. This is typically done through their supports coordinator, or in some cases, a family member or the individual themselves. They've heard about the services, they're interested in learning more about the services, they'd like to meet with OneWell. Once they've reached out, we then move to our intake. So we will schedule an intake. This is typically a virtual meeting that we'll have with the individual, their supports coordinator, or their power of attorney or guardian. That way we can discuss their transportation needs. Once we've had that intake, we're going to discuss what their transportation needs are, how we can meet them, and what a budget would look like for that individual. My team works on creating those budget plans for those individuals. We then send that to their supports coordinator who reviews that budget just to make sure it can fit within their plan, it's consistent with their goals, and that it's meeting the needs for that individual. That SC submits what's called a critical revision, and that critical revision is getting approved by the local administrative entities or the AE through that county. This is what gets that authorization for funding for that individual to utilize Uber transportation services or any services that are being added to an individual's ISP. Once we have that approval for services, we move to the activation for the individual, where we help set up that individual, again, that guardian or that contact for them on that OneWell app. Multiple family members, friends, whoever that individual designates can have access to that app to support them. But we make sure that they're set up on the app. We do a nice training through it. Again, it's a very simple process for booking your rides, but we want to make sure that everyone feels comfortable and set up for success when the service starts. Once that app is downloaded and the training is completed, that individual will have access to start booking rides on the start date of their services. And just some quick overshots of our OneWell app. So it, as I mentioned, it looks very similar to if you were to log into the Uber app for your personal use. Um, some key differences are that we set up pre-designated locations for that individual. So again, they don't have to enter in an address every time if they need to go to work. It's already set up in a system. Through our app, they're going to choose one of two options, whether they want an immediate ride or they would like to schedule a ride to have that in the system for them for a later time. Uh, they'll then select from the map view of a location that's pre-designated for them. Once they select that location, it will show them what that route is going to look like for their trip, along with the fare and the distance that's going to be conducted. And then they just select their date and time on the app. And then once that date and time is selected, the route is confirmed for that individual. They hit approve ride, and that ride has been scheduled and booked to Uber. So a driver will receive that trip, and once that driver has picked up that trip, they'll be able to view that driver's information right from the app as well. So that includes a picture of their driver, a picture of their vehicle, and their information. So the individual will know who is picking up their ride. And then, as I mentioned earlier in the presentation, we do provide other services in addition to our Uber transportation. We do have assistive technology, home modifications, nursing care, in and out of home respite, our in-home and community supports, and companion services. So in closing in this presentation, I do like to go through a couple quotes that we have from some of our individuals that are using the transportation services. One individual stated, "OneWell has changed my life. I used to worry about losing my job because of transportation, but now I have no worries. I can't imagine life without the amazing people at OneWell. They are patient and always there for us." OneWell is amazing. They've always helped me when I need it. I had some issues in the beginning, but they made sure I got to the right place. I recommend OneWell to everyone because they are the best. They're always there for you when you need them. And OneWell Uber app is amazing. It's so easy to schedule my ride and track the driver. I can see where they are at all times. Everything I need is in the app. I just pick what I need and schedule it. It's much easier than other transportation services. So that concludes our presentation for the evening. If you have any questions, please feel free to contact us. Our main line is 855-720-9355, or you can feel free to contact us directly at ride@onewell.org, or reach out to me directly at charles.nightlinger@onewell.org. I'll leave this up on the screen in case anybody would like to write down some information. But with that, we can open up the chat to any kind of questions or anything that anybody would like to discuss.
Thank you so much, Charles, for this presentation. And as Charles said, we welcome your questions. Is there anyone who would you like to ask a question? Yeah, we have a question, I guess. From Sandy and Samantha.
Okay. So I see Sandy asked, are there any difference in Uber drivers? My daughter currently uses Uber but has trouble with drivers and feeling unsafe. So there is a difference between regular Uber and Uber Health drivers. Uber drivers do receive criminal federal child abuse screenings along with sexual offenders registry checks. Part of Uber Health, those drivers have to maintain a 4.5-star rating as part of the Uber Health program. So you do get a typically higher consistency of drivers that are working with our individuals. If there are issues, and now, somebody could have a bad day, somebody feels disrespected or rude. We do take that in consideration for our individuals because we want everyone to feel safe, comfortable, and respected in their transportation. We know for a lot of individuals, this is a new service. This is something new for them. It's great that your daughter is already familiar with regular Uber, but we want to help support her with that transportation as well, to make her feel safe and secure. Samantha asked, how does OneWell accommodate individuals who have adaptive safety equipment in vehicles such as seatbelt, harnesses, or guards when utilizing Uber Health? Is this level of support currently available? So that's a great question. So typically for individuals that need extra support, we do rely on natural supports to assist them, as Uber drivers may not know that they need that adaptive equipment for that trip. As an Uber driver, they're not privy to any kind of HIPAA or specialty information for that individual. So if they are getting into a vehicle, um, they would rely on maybe natural supports, or if they're going to a program, somebody at the program to make sure that they're getting in, they're being buckled in safely, and that they're secure for their trip back home. So we work with the natural supports for that individual to see if there's a good fit and a possible solution for their needs. There are also other options such as Uber Wave if an individual does have a electric wheelchair and needs assistance via wheelchair accessible vehicles. Um, those those types of Ubers are typically located in select areas in their marketplace, so we are able to check to see if they have the opportunity to utilize something such as Wave. Stephanie asked, I like to know my driver doesn't speak English. What should I do to fix it? So that's a good question. It comes up. So anytime you have an Uber driver, English may not be their primary language. The world is full of different languages, and Uber drivers can speak any of those varying languages. Here at OneWell, we do have a lot of staff on board that speak different languages, and that can help assist. So if you're having communication problems with your driver, you're more than welcome to contact us. Again, we provide that 24/7 support for all of our individuals so they can have that assistance be as successful as possible. So if you're having difficulty speaking with your driver, having difficulties relaying certain information, we can contact that driver on your behalf to try and fill in that communication barrier gap. Just making sure I didn't miss any. Marcy asked, is there a set criteria that determines if someone is eligible to use a service? How is the financial/cost piece determined? So that's a great question. So there are some eligibility qualifications that an individual must meet. So the individual has to be 18 years of age or older. Individuals that are 18 years to 20 years of age do have some limitations with the service through ODP. Individuals in that 18 to 20 category can only access Uber transportation for the purpose of competitive integrated employment, or to access waiver funded programs such as day programs or another service that is offered through their waiver and it is covering that cost. Individuals 21 years of age or older have more freedom with the service. They're able to access the same things, employment. They're able to access day programs as needed, but they also have the opportunities to access that community integration pieces, those medical appointments if they qualify for that. Um, Now, when it comes to the financial cost, again, that's actually determined during the intake process where we discuss the transportation needs for the individual. We look at what kind of transportation they need, what locations they need to go to, how frequently they may need to go to those locations, and then we work on our end to see how much those trips are going to cost rate-wise. We then put together a service request for their supports coordinator that outlines the cost of the trips and the units that are required. But one of the nice things is with this service, we do this at a net neutral cost for our individuals. So OneWell is not charging anything additional to what those rides are costing through Uber Health. And then their waiver is covering those exact trip costs. Can we just use Uber Health through OneWell, or do we need to transfer her IHCS and companion services to OneWell as well? That is a great question, Sandy. So this is a standalone service. We do not require any of our individuals that want Uber transportation services to have other services with OneWell, either prior or moving forward. Now, of course, we would love to provide other services for that individual, but it is not a requirement to have services moved over to OneWell in order to qualify for that transportation service. We want to keep it as open and flexible for all individuals because whether or not they're a current OneWell client with or they're a future OneWell client with us, we feel everyone has the right to access transportation. Sorry, I have to scroll back up. Chat moved a little too fast for me. Carson and Dad asked, do you have a client with OneWell to utilize the do you have to be a client with OneWell to utilize? So same question again. You do not need to be an existing OneWell client to qualify for Uber transportation services. You do not have to move over any other established services. But again, if you really enjoy your services with OneWell and you are looking for a new provider, we are more than happy to accommodate those services as well. Stephanie said, my mom have the email at night Uber. At night, does Uber driver around nighttime to my mom? I'm not quite sure I understand the question, Stephanie. If you would mind resubmitting it in the chat, maybe I can better understand it. And that seems to be the last question. So if there are no other questions, I see that Katie did drop the emails for both myself and our Uber transportation department in the chat, along with our website link. So if you do have any questions, I know I'm one of those people that the second something is over, I think of the question that I couldn't think of during the meeting. Feel free to reach out to me directly or that ride@onewell.org email. Ask any questions if you need any assistance starting the process, making contact with a supports coordinator. I'm more than happy to help anyone when it comes to their transportation needs. I do thank everyone for attending this webinar this evening. I know it's right after the holidays and we're all kind of getting back to the flow of normal life after Christmas and New Year's. But I really do appreciate you taking the time and joining us tonight, and I hope I hear from some of you soon. Thank you.
Thank you so much. Thank you, everyone, for joining our webinar today. We will continue to share many upcoming events and webinars on our social media accounts. Please don't forget to follow us, and thank you for trusting OneWell Health Care and for your valuable support and for your questions and your attention. We wish you a wonderful day and look forward to seeing you at our future sessions and seasons and webinars and activities. Thank you so much, everyone. See you. Have a great day. Thank you, Charles.
Guys.
Thank you,
Katie.
everyone.